Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. My name is Anissa Nadira. I'm from uh, Jakarta School of Prosthetic and Orthotics. Today, I will explain about the time up and go test, or uh, TOG, and Physiological Cost Index, or PCI. But I will share my PPT first. Okay, like I said previously, I will explain about the time up and go test, or TUG, and physiological cost index. This is my table of contents that I will explain in this opportunity. There's introductions, proposed tools and directions, and the last is instructions. So, time up and go test is really simple, quick, and often used for clinical performance-based measure of lower extremity functions, mobility, and fall risk. So, this is a simple test that can use to assess a person's mobility and requires both in static and dynamic balance. So, there's a pictures that can show us how to do the time up and go test. The patients can wear their regular footwear, and uh, or the patient can use walking aid if needed, and the patient starts in a seat positions and then stand up uh, while the therapist or the healthcare provider comment to walk 3 meters and then turn around back to the chair, and then sit down. The time stops when the patient sits in the chair again. And then the purpose of the test. The purpose for this test is observe the patient's postural stability, gait, stride length, and sway. So this test can help the healthcare provider, the therapist, or the prosthetist to understand how well you are able to get around. And then for the tools and the directions, uh, we we should prepare the stopwatch, tape measure, and masking tape, and then chair also. And for the directions, patients should wear the regular footwear like I said before, and begin by having the patient sit back in a armchair, standard armchair, and identify a line 3 meters or 10 feet away on the floor. The patient can use a brace, cane, walker, or any device that patient use to walk. And for the instructions for doing this test, when the healthcare provider say go, the patient should stand up from the chair and then walk to the line on the floor, or maybe we can we can do this in the outdoor at the normal pace, and then turn, and the patient walk back to the chair at the normal pace, and then the patient should sit down again. So how can we determine there's a risk of fall or no? If the patient walk more than 20 seconds, it can determine that the patient has a high risk of falling. And if the patient walks less than 20 seconds, it can determine that there is a lower risk for falling. So we move to the physiological cost index. Physiological cost index is a test that usually used to assess the energy cost in working of healthy people and also for persons with lower limb amputations working with prostheses. Uh, how about the equipment? For doing this test, we just need stopwatch, heart rate monitor like tensimeter, measurement rod, and if you have a treadmill, you can use treadmill. And then pencil, pen, and paper for uh, write the the results. And then for the setup, the participant will work with or without assistive device in three items is required. First is resting heart rate, working heart rate, and walking speed. For the resting heart rate is measured first in beats per minute. A participant can sit quietly for a few minutes until heart rate reaches a steady state, and for the walking speed is measured in meters per minute as the participant walks on a level indoor surface of known distance of their preferred place. And walking heart rate also measured in beats per minute. When walking heart rate reaches a steady state, participants should walk until they reach a steady heart rate, at least 4 minutes. And then, how about the instructions? How about a healthcare provider doing this test? First, participant not allowed to consume any coffee, nicotine, and smoking also. And then we should ask the participant to sit at least 4 minutes, then measure the resting heart rate. And the third, participant walk in treadmill, or you can just use the measurement roll and the patient walk in the floor, and then measure the walking heart rate. And the fourth, measure the distance and time that participant reach. And for the last, fill the form to calculate the PCI. We can see in this slide there's a formula for calculate the PCI test. PCI beats per meter and walking heart rate dikurangi resting heart rate and then dibagi speed meter per minutes. So thank you. That's all my explanation about the time up and go test and physiological cost index. I hope this explanation can give you some uh, knowledge or more knowledge. Thank you for your attentions. Wassalamualaikum warahmatullahi wabarakatuh.